All right, guys, 1 minute to go.
Those lights are so bright.
I'm trying not to look to the side, like when you're driving and things, and you have to not look at one, you just look to the side. I know managing three things. I leave the phone at home.
Oh,
I think they said we could have done like WhatsApp, but we will leave it
that's a
alone.
lot. Yeah.
Facebook and YouTube.
Yeah.
Yeah. Good evening and welcome to another edition of Checking In on You by the Southwest Regional Health Authority. This is a very interesting session we're going to have this evening. It's entitled Ladies, Let's Talk About You. And we thought it very important to have something like this, especially as we're approaching International Women's Day, which is on the 8th of March. This evening is going to be Ladies Talking About You, and it's going to be done by our lovely panel of ladies. I am Dr. Sandy Arthur, a primary care physician too with the Southwest Regional Health Authority, and I am your moderator for this evening. Please allow me to introduce our panel. To my left, I have Mrs. Kiri Arti Homer Kimraj. She is a registered dietitian with the Trinidad and Tobago Association of Nutritionists and Dietitians. She has been working at the Southwest Regional Health Authority for about 11 years as a community dietitian, in addition to providing medical nutrition therapy for patients attending the local health centers. She also uses her skills as a 200-hour registered yoga teacher to advocate mindful physical movement and promotion of good mental health. Mrs. Homer Kimraj, thank you for joining us.
Good evening, everyone. It's indeed a pleasure to be here.
Next, we have Dr. Siobhan Hussein. She is an obstetrician and gynecologist and has been with the authority for the past 12 years. Her role revolves around being a caregiver of women throughout the life cycle, as she aims to help women carry healthy, safe, and successful pregnancies, as well as manage the effect the female reproductive system has. Other professional interests lie within the realm of women's mental health. She has specialist degrees from both the Royal College of Obstetricians and Gynecologists in London and locally with the University of the West Indies. Dr. Hussein.
Thank you all for the opportunity to be here.
And our third panel member this evening is Ms. Bernadette Seeley. She is a senior victim and witness support officer, and she strives in her professional training as a social worker to work with a multidisciplinary team that encourages systems and structures that will ameliorate social ills and facilitate the growth and development of others. She holds a Bachelor of Science degree in social work and a Master of Business Administration with emphasis in human resource management. So we have Ms. Seeley.
Pleasant good afternoon, and thank you for being here.
thank you for being here as well. So, as I said, this is our Checking In on You series, and just to share a bit with you about what that is, almost a year ago, the Southwest Regional Health Authority tried to find innovative ways to interact with our public and those persons within the Southwest region. And we thought that we should intentionally reach out to you and have sessions with you where we discuss pertinent health issues and try to give you as much information as possible by bringing the experts as close as possible to you in the comfort of your home. Today, we are going to be viewing the Facebook page for WAC as well as YouTube. So if you have any comments that you would like to share there, you can do so and we will try to address them. So we're going to start our discussion for this evening, and we have, I think, a very rounded panel this evening. And I want to start with Dr. Hussein. In your role as an obstetrician and gynecologist, you see women at multiple stages of life, and then there are certain aspects of your care of them that you would like to highlight, I'm sure. So I would like to hand over to you at this point in time so you can start us off.
Right, so thank you, Sandy. My job spec or my role really goes forward from females that are in their teenage years and the pre-pubertal as well as the adolescent female up until the adult females and even into the menopausal stages of life. We focus primarily on antenatal care. So this deals with women who are not only pregnant but planning pregnancies as well as in the postpartum period. So that means after delivery. And we handle care with respect to their physical health, their mental health, or at least try to facilitate handling their mental health. As well as for the menopausal lady, we try to deal with all the aspects that are hormonally related, physically related issues, especially with having abnormal menstrual bleeding around that time, and just to carry them forward.
Okay, great. So you mentioned antenatal or pregnancy care. When should a woman see her doctor when she finds out she's pregnant?
Well, I would actually like to think that women should seek care before they are pregnant to start off with. So this is called preconception care. Ideally, they should have a visit with a doctor prior, just to make sure that their body and their mind is in the proper frame of health before they can try for a pregnancy. Usually at this consultation, we would give general advice regarding, diet and exercise, what to eat, what not to eat, maintaining a healthy weight, avoiding certain things like cigarettes and alcohol specifically, as well as being placed on folic acid, which is absolutely important and should be started 3 months before starting to try for a baby.
Okay.
Right? And this is important because it helps prevent any defects in the developing baby, particularly of the brain and the spine.
Okay.
Yes. As long as a woman is pregnant, we like for them to join clinic as soon as possible. So as long as your pregnancy test is positive, we would like to see you, right? I know that that is not practical for most people. Many women, I'm not quite sure why, have the impression that they should join clinics at around 20 weeks pregnant, so around 5 months. And that is absolutely not something that we like to encourage. There are certain things that we would like to sort out from very early in the pregnancy, particularly what we would like to call dating a pregnancy. So doing an ultrasound to ensure that one, the baby is in the correct place, the baby has been growing well, and to confirm the due date of that patient. In addition, in the first trimester, so this is the first 13 weeks of pregnancy, we would also look forward to doing special ultrasounds that can help determine whether the baby is growing with any defects.
Okay.
Or can give any clue that something else is going on with the baby that we would like to investigate.
Okay.
Yeah, but as soon as possible, as long as your pregnancy test is positive, please join a clinic and let us see you so that we can plan, counsel, and put things in place.
Okay. Well, in our experience in primary care, because that's my home base, we oftentimes don't see ladies until they've already started to show signs of a pregnancy.
Yes.
So it's very good that you're reinforcing that point for us this evening. And just to let persons know that all of our health centers have antenatal, or if you want to call them pregnancy clinics, where you can go, you can join to be followed up for your pregnancy. There are certain days that would be that clinic. However, if you go on a particular day, you will be given advice as to when you can come back and seek care for that pregnancy, so we can ensure that Dr. Hussein does not have to deal with too many complications when we pick up something in primary care and then have to refer to hospital. So you mentioned a very important element, well, two important elements. You mentioned nutrition prior to becoming pregnant, as well as mental space and mental health. So I'd like to go to our expert dietitian this afternoon so she can share with us some tidbits and advice on nutrition for the pregnancy.
So good evening again, everyone. So based on what Dr. Hussein stated, if you are in the frame of mind or you think that you want to be pregnant, examining your diet is crucial in terms of maintaining a healthy pregnancy. So upon discovery of being pregnant, as she mentioned before, it is imperative that you have adequate amounts of certain micronutrients that are essential for baby's growth and development, and also to maintain mommy's health. So we want to examine in deeper the folic acid and folate, as well as iron. So usually when we are pregnant, an antenatal supplement is recommended, and this is to ensure that you can meet the recommended daily allowance of between 400 to 800 micrograms of folic acid or folate. Some dietary sources would include all our dark green leafy vegetables, our legumes such as our peas and our beans. Iron, recommended to be about 27 milligrams per day. This is also key for fetal development. The heme, or biologically available sources of animal sources of iron, can be found in all of your lean sources of protein. You can also find it in your plant-based sources, inclusive of your dark green leafy vegetables as well. Now, another vitamin or micronutrient that pairs well with iron is known as vitamin C. So vitamin C can actually enhance the heme iron absorption, especially from your citric acid foods or even via a supplement form. Some dietary sources of the non-heme iron would include things as your iron-fortified whole grain cereals, fortified oats, bran flakes, spinach, your peas and your beans, your sardines, your crab, and your turkey. Some other micronutrients that we also want to focus on would be our omega-3 fatty acids, and these can be found in our seafood. The seafood that we would like to consume should be chosen from fish that are lower in methyl mercury, as omega-3 is paired with improved cognitive development in young children. Some examples of where we can find these omega-3 fatty acids would be in our catfish, our cod, tilapia, whitefish, mackerel, salmon, sardine, and herring. So approximately 2 portions a week, or 280 grams, or that recommended by a registered dietitian, would be recommended during the stages of pregnancy. We also have iodine and choline, which also helps with baby's neurological development. And we can find these micronutrients in all our dairy products, our eggs, our seafood, and even our iodized salt. Calcium also plays a significant role for baby's development as well as for mommy. So we want to focus on foods that are rich in calcium so that we can get at least 1,000 micrograms per day, and this can also be found in all of our dairy foods. During pregnancy, besides ensuring that we have adequate amounts of these micronutrients, maintaining a healthy weight is also important. So some of the screening that we do as dietitians is try to gain a history of mommy's family in terms of if there's a strong presence of gestational diabetes, hypertension, any heart diseases, so that this can be an indicator for the duration of mommy's pregnancy. So we recommend that pregnant women try to maintain a healthy weight. So if your BMI is less than 18.5, The recommended weight gain is between 28 to 40 pounds. If you have a BMI over 30, we recommend a weight gain of 11 to 20 pounds. Therefore, consuming nutrient-dense foods from all of the Caribbean 6 food groups, small, frequent meals throughout the day, ensuring that you are well hydrated. Of course, we recommend that you avoid the alcohol, avoid the cigarette smoking, as these things can be harmful to baby as well as mommy. You will be well on your way to having a safe and healthy pregnancy.
Thank you very much. That's quite a bit of information I was actually trying to process as we went through. And I think just to break it down a bit more for them, you're basically saying that there are some targets that you would generally see in women in terms of their weight gain and so on during pregnancy. And then the things you mentioned basically is if you're eating a very balanced diet, you're going to get a lot of the nutrients and so on that you need for your pregnancy, correct?
Correct. So sometimes what can occur during pregnancy is something known as what we like to term morning sickness. Unfortunately, morning sickness does not only occur in the morning. So for some pregnancies, pregnant mummies experience as one of the side effects severe nausea and vomiting. And what can happen is that this can severely affect mummy's nutrient intake, as she now has reduced appetite, or whatever she consumes, it comes right back out. So that's why the antenatal vitamins will play a key role in addition to her dietary intake in meeting these recommended daily allowances for the micronutrients that are recommended.
Okay, great. So Miss Seeley, because I know sometimes in our ladies, they experience different challenges, and I know that your team in the Victim and Witness Support Unit, y'all have a special interest and area of women that y'all like to focus on in terms as it relates to intimate partner violence and so on. So can you share a bit of that with us at this point in time?
Yes, and thank you again, ma'am. So this afternoon, I would really like to share about some of the things that we are doing at the Victim and Witness Support Unit and continue with some of the prevalence of gender-based violence. Now, the Victim and Witness Support Unit is a unit that is within the Trinidad and Tobago Police Service. That unit was established in 2008. Since the establishment of the unit in 2008, we would have seen over 30,000 plus persons, and that would have included domestic violence, all victims of crime. We would have seen those persons. The Victim and Witness Support Unit has been operating for the past 15 years. And we urge persons to make a report with regards to domestic violence or gender-based violence, intimate partner violence. They are all similar but different in some ways. The Victim and Witness Support Unit, persons, when they come to our unit, they can access our services through making a report. Once they have made a report of GBV, that report goes to the Gender-Based Violence Unit of the Trinidad and Tobago Police Service. This is a special unit with specialized officers who does the investigation in gender-based violence. Once that report goes to that unit, they would then refer the report to us, and we would work alongside the investigation. The Victim and Witness Support officers are professionally trained to deal with all victims of crime and those of gender-based violence. Our service that we provide are psychosocial services to meet the needs of those victims that are affected by gender-based violence, as well as other victims. Once these persons come to us, especially the gender-based, because we are now speaking about gender-based violence in this respect, once a gender-based violence victim or person who would have been affected by this comes to the unit, we then provide them with a safety plan if they are if they choose to stay in the relationship. And we also do exit plans for those persons who wish to exit the relationship and doing so safely. The other service that we provide for persons is accompaniment. We would accompany them to either the hospital or to the court, and sometimes we'd have to do referrals to other agencies that, and in doing those referrals, and this is why I'm so happy to be meeting some of you all, because when we get that referral and we pass it on to another agency, we like to have a sort of intimate relationship with the agency so that our clients will not be experience secondary victimization.
Okay.
It is important for persons to understand that in Trinidad and Tobago, because of our culture, victims are sometimes treated again unfairly when they go to different agencies. And sometimes it's just because persons don't understand or not aware of that individual's present situation. So it's important for us to treat with all issues that would minimize secondary victimization.
Okay.
The other service that we provide for victims or persons who have been affected by gender-based violence are we do outreach programs. We also give them a fair idea of the court system. And the court system, for Trinidadians is a very difficult and, tedious one in terms of a lot of people not accustomed with the court system. And so if they're not accustomed with the system, what happens when they go to the court, they're very intimidated and fearful. And so this is why we give them so much support in that area, as well as we give them explain a protection order, the details of that protection order, and sometimes support them in applying for the protection order through the court. Okay. Today, the protection order, you do most of your court online because we, since the COVID, they haven't had physical court. So most of the persons who are applying for the protection order and so forth, they now have to do that online. So we help persons in these areas. We help them to prepare for that sort of thing. We do outreach programs as well, covering domestic violence, gender-based violence, intimate partner violence. And in doing the outreach program, we have gone to schools where we have lectured on domestic violence. We have gone to community organizations. We have done workshops with them. We have even partnered with non-government and governmental organizations to do said work with respect to making people aware of gender-based violence and the effects of it. For instance, we have worked with you all in the last just before COVID. Yes, in 2019 to early 2020, and we would have visited most of the health centers in the division and did some presentation. Out of that came a lot of persons becoming very knowledgeable about domestic violence. And in that, as I mentioned, as we are talking about that, one of our target health center population was that of the prenatal and postnatal. And the reason for that, we had discovered from our research and from the research done by the UN that a lot of women who are pregnant goes through domestic violence, and sometimes the baby situation triggers that gender-based violence towards them. And it is a difficult situation to be pregnant and then having this situation face them. And sometimes for the first time, they are recognizing how violent their partner is towards them, or how, the abuse that they might have suffered, casually, but now it has intensified. Mm-hmm. And so this is why we have, do a lot of focus on gender-based violence.
Okay.
Yes?
that's quite a bit. And I'm glad that you were able to highlight the importance of the work you do, even as it relates to our antenatal or perinatal population, that i.e. our population who are pregnant and post-pregnant or just prior to pregnancy, because I think everybody has this notion that pregnancy is a happy, enjoyable time for everyone, when sometimes that is not the case. And I'm happy that you all also offer the psychosocial support as well for that group of clients. I have something else I want to ask, but just before we go back to that, I'd like to come back to our dietitian, because we mentioned and we spoke a lot about nutrition for the pre-pregnancy time and the pregnancy time. But a lot of mummies come to ask about, well, how should I feed my teenage child? How do I ensure that my daughter, as we're focusing on ladies today, how do I ensure that my daughter is getting adequate nutrition as she is going through puberty?
So that's an excellent question. So this is a very, very important time in any girl's life, because she's now on the cusp of becoming a woman, as this is where the onset of menstruation will begin, usually between the ages of 9 to 13, and now we are seeing a little bit of change in that age gap as well. So this is the physiological changes is related to development of the primary sex characteristics as well as the reproductive organs. Now, this is a very sensitive age, because this is the time of life where girls are now a little bit more aware of how they look, their body type, their body size. So it's imperative that we try to empower a good foundation for good, healthy eating habits, where we encourage nutrient-dense foods from the 6 Caribbean food groups, highlight the importance of regular meals. So a lot of our teenagers, our new secondary school girls, don't like to carry a lunch kit to school. So what can happen is that they may skip breakfast, they may not have lunch. If they receive school feeding meals, they don't like what come today, they're not going to eat it. And then when they go home, a lot of snacks. And what comes with all of these snacks are a lot of added sugars, a lot of excess salt, and a lot of saturated fats. And when that trio comes together, they can actually increase the risk of adolescent obesity and then put that girl at risk for a lot of chronic diseases later on. So what we tend to advocate is a caloric intake of roughly between 1,400 to 2,200 kilocalories per day. And of course, this is going to be individualized based on the girl's physical activity levels, her anthropometric measurements. Generally, about 45 to 65% of our calories will come from carbohydrates, which we want to focus on the higher fiber options. So we encourage a lot of high fiber whole grains like your rolled oats, your barley. We also look at encouraging local foods, so introduce the kids to eating things like ground provisions, sweet potato, yam, dasheen, and now is actually one of the times of the year where we have a lot of those ground provisions readily available. So encourage the girls to eat locally grown foods. We are also looking at about 10 to 30% calories coming in from protein. So protein is extremely important at this age, because this is where we have a lot of muscular development happening. So we want to aim for about 35 to 105 grams per day. Of course, this will vary based on her physical activity level. And just about 25 to 35% calories from the fats. So this is about 39 to 54 grams per day. Now, there are also certain micronutrients that we would like to highlight. So we're going to go through the alphabet a little bit here. So we're going to start off with calcium. So calcium is important because we know it works with phosphorus to maintain healthy bones, as I mentioned before, muscles and teeth. We're going to move on to vitamin D, which we can get from sunlight, our milk, our eggs, our mushrooms, our salmon, and this also helps to regulate the calcium and phosphorus. And then we have vitamin K, because remember, with the onset of menstruation, we are looking at things like blood clotting. So vitamin K helps with the blood clotting, and we can get this from all of our dark green leafy vegetables. And then we want to focus a little bit more on things like vitamin B12 and our iron. So B12 is crucial in terms of the formation of red blood cells and DNA formation, and we can get B12 from our meat, our fish, our eggs, and our milk. and iron about 8 milligrams per day. And we can also get this from red meat, our whole grains, our dark green leafy vegetables, and our beans. So basically, all of these micronutrients can be found from all of the 6 food groups. So we want to encourage teenagers to have at least 3 meals per day with 2 healthy snacks, and also to get active, get up and get moving, at least 150 minutes of physical activity per week, so that we can develop and strengthen our muscular tissue, our bones, and ensure that we set a good foundation for what is to come later on during the life cycle.
Great. So I hope that they pay attention to that, the amount of things that they have to do. But again, it comes down to how you feed and how you eat and how you use your 6 Caribbean food groups.
Correct.
Good. Miss Sadie, you mentioned in your chat a little earlier that you all also do some outreach programs, and you also ensure that you educate. So does this education include that secondary school group as well?
Yes, it does. And before I go into that, I would just like to highlight the fact that our teenagers presently are having real issues with their life situation, with life, especially after this COVID situation. Now, the thing is, before COVID, what happened is that a lot of people would have been in and out and about. And that would have given the opportunity for some young people to get involved with friends and, to be more active in their lifespan. However, this time it is the young persons are inside more. They have become very addicted to their tablets and so forth. So what is happening is that in the schools you would find there is a lot of sexual activities taking place, a lot of beyond control behaviors with young people, a lot of aggression. And all of this stems from what our society would have been providing or sharing with our young people. Now, when we go to the schools to talk about domestic violence and to talk about other issues, you would find that it is only at that point you would have some young people coming out and speaking about their issue and their experience with violence in the home. Today, in Trinidad and Tobago, for the last 15 years, so I would just take it from the last 15 years to now, we would have had, because they were counting, we had, not counting, but we would have CAPA doing work with us and so forth. In 2012, the domestic violence situation had a marked increase. 2018, we saw another spike. Today, every year, almost every year, we have something like 3,000 plus reports of domestic violence. In 2020 to 2021, 2020 to 2023, as a matter of fact, now, we would have seen over 2,500 persons affected by gender-based violence. Now, what does that say for the family? What are our children seeing? Because we are only talking about the 3,005 that reported the issue.
Right.
But we are not talking about the persons who have not reported. The statistic shows that 1 in every 3 women have been affected by gender-based violence. Apart from that, last year in 2020, we had 57 women killed. Out of that, 20 of them were related to domestic violence. 13 were male persons. So out of all the stats, 33 persons were killed. But in relation to domestic violence, in relation to, and we call it domestic violence in Trinidad and Tobago because our legislation has it domestic violence.
Okay.
And under that law, under that legislation, we would have had those 33 persons being killed, 13 male, 20 women. Now, you might say, but that's a small amount. But it's not small. It is not small because we have to think about the families who came from those homes. And not just the children in the home, but we're talking other relatives. We are talking about our neighbors because everybody is being traumatized by that situation. Because when you have a neighbor who would have been killed by her husband or so forth, you then becomes very much aware of a situation, but you are also traumatized. Secondary traumatization. So the situation with our young people is not one that we could just, mull over. It is something that we have to pay attention to because by the time a girl reaches 15 years, some statistics would have told us that they would have already become sexually active. It means to say that not much food preparation, their body preparation to have babies were done, and so that they now become pregnant and having children. And the last statistics that we would have, that Trinidad and Tobago had the highest rate of teenage pregnancies. That doesn't say small amount, that says large amount of young people having children. When these young people have children and they weren't aware of how to take care of themselves, then you would find that they are not able to teach their children how to take care of themselves. And that is where the danger is, because it's going from one generation to another. And so in the schools, we try to speak to the young folks, we try to speak to the young people so that they can understand certain things in life. They can understand how to resolve, and most of the time, what drives those young persons to getting involved with the opposite sex or getting involved in sexual activities and becoming uncontrolled is one, they are experiencing the violence. And those are some of the effects of the violence. So they become violent themselves, and at the end of the day, what you find happening is a lot of bullying in schools taking place, and we say, well, what Trinidad and Tobago is coming to. But the thing is, where those situation is taking place is right in the home. And sometimes we all, as citizens of Trinidad and Tobago, need to pay attention to our neighbors. We need to look and support a good situation so that there is times when persons can see a situation taking place and make a report. The domestic violence situation, the Domestic Violence Act would have changed since in 2020, and it now gives persons outside of the family unit to be able to make reports and to apply for protection order. So a mother can now apply for a protection order on her daughter. A child can apply for a protection order for himself or his parents. These are some of the changes that the Domestic Violence Act would have amended. The thing is, we need to pay attention to all of these things, to the health of the child as well as to the mental health and the social attitude in which we are providing for our kids. We take things, simple things. Somebody just cuss out somebody and you see everybody fighting and they put it up on social media, and that is the thing for the day, and everybody getting likes, millions of likes for violence. It has to stop somewhere.
I see your passion about it.
Yeah, it has to stop somewhere. If we don't, one of the things that people can really do, and I'm just saying that's one of the things that they can do, is that if you turn your social media off to violence, it will help curb violence. Because what happens is that once we take it in and once we feel good about it and we feel satisfied, it means to say it is perpetuated in our culture. Then we see things like a fella saying to a girl, well, you know, it had a time I saw this young man came to school, that was just the first after COVID, raising blade in school, fighting with cutlass in school. And this is a scary thing for all the other children. It is a scary thing for him too, because you have to imagine where he had been for him to commit that situation. Mm-hmm. So the thing is, we all need to pay attention to our young people. And that is very important to our society. It takes, according to the African saying, it takes a village to bring up a child. Not one person, not two people. Sometimes we see our neighbors going through a lot of problems and we don't pay attention to that. And we say, that's them, the drinking, the smoking. Most of the children spend their nights out on hanging out because they're afraid to go home. People would not know that. Some people would not know that. Again, some people will know. And we are saying, make a report. Do something. See something. Do something. Say something.
Food for thought and also information on how the community can act as well. And thanks for highlighting that domino effect that some of these issues have and how it spills over from being just a household issue into being a community issue, or coming from a parental issue and then spilling over into the child's life, and then they take that into their school and to their surroundings as well. So you're encouraged this afternoon to act. Take advantage. I've learned stuff this evening as well. I hope you have as well, where you, if you notice something, you can make that report as well, and pay attention to your communities. So we've spoken a bit about the adolescent group and some of the challenges they face. But on the other end of that, for women, there is that life after the menopause. And it can be a very scary time, a very uncertain time for many women. And I know that Siobhan would see a lot of that in her practice. So can you share a bit about menopause, give us an explanation on how you generally tend to approach it in your practice?
Mm-hmm. So menopause is the gynecological aspect of my job. By definition, menopause occurs when a woman would have stopped having her periods for an entire year, right? So an entire year continuously of no periods, then we would consider a woman as going into menopause. Menopause in itself has a lot of challenges, both physically, mentally, emotionally. It occurs when the ovaries, which are the organs that produce hormones, shut down. Yes, basically these would affect all aspects of a woman's life. So it's not just a simple cessation of periods. Before most women go into menopause, which is on average at around the age of 51, 52 for our population, they would usually go into a premenopausal phase of life. And this varies for some women. It can happen a couple of years before, up to 5 years before in some women. And during this time, there would be hormonal changes that can cause the woman to feel differently. Some of the most common symptoms that they would present with would include emotional liability. So sometimes they can be very moody. Sometimes their husbands or their partners may not understand why the woman is being so moody. I assure you, they are not going crazy. It is part of the menopause. They may be more depressed than usual. They may have bouts of tearfulness. They may not be able to concentrate on tasks as they usually would. In addition to, they may have physical changes. For example, dry skin, hair loss, weight gain. In addition to, in regard to their sexual behavior, most women that are going through menopause may have a decreased sex drive or a decreased libido. And vaginal dryness that occurs with it doesn't help the situation for them to want to have intercourse. One of the biggest aspects of menopause in most women is abnormal bleeding during the menopause. I would usually describe it to patients as a car that's starting up, right? Normally it will start up very erratically in the beginning until you have a nice smooth sailing. And then in the end, when you're going to turn off the engine, it will have an erratic stop. And the bleeding in menopause presents the same way. It can be so bad in some patients that they may have continuous bleeding, and this can have other effects where it causes their blood count to fall, and they may need to be investigated. They may need to make sure that the reason for the bleeding is not just the menopause, and that is not something more serious, for example, a cancer, which typically would occur around the menopausal age group. Yes. So those are the most common problems that women would face around the menopausal stage. There is hormone replacement therapy available for women who are having a lot of difficulty coping with menopausal symptoms. And I think it's very important that women are educated about the menopause, because it isn't just a physical condition, but it can have long-term effects where it increases your risk of having a heart attack, a stroke, developing clots, losing your bone mass or your bone density later on. So in addition to being educated, they should also be counseled on what they can do to help prevent these things from happening. Supplementation that they can take to help prevent that from happening, and as well as diet and exercises, and
Okay. We're staying with you a bit because there's also some examinations and tests that our female population oftentimes should be doing, and they don't. And we wanted to just talk about those tests a bit first before we go on. Pap smears.
Yes.
As a primary care physician in the health center, a lot of women would say to us when we suggest, well, okay, it's time to do a pap smear. But my friend told me that this is not a nice test to do. And that has been their barrier to getting their pap smear done. So what are pap smears and what are the benefit of them?
All right. So pap smears are a screening tool. It's basically a very quick and painless examination where we look at the mouth of the womb. So the mouth of the womb is accessed through the vagina. Basically, your doctor, your clinician will take a look at the mouth of the womb to ensure that it looks healthy. And they will take a very small sample from the mouth of the womb that they will send to the lab. This is then looked at under a microscope, and it will let us know if there are any changes that can lead to cancer in the long run. I know that there is a big fear factor with regard to having your pap smears done, because many people think that it is uncomfortable, but that is not at all true. And the clinician knows that it is an intimate examination. Of course, if you come to do your pap smear, it will be done in a private setting. There will be a chaperone available and present. You'll be walked through the procedure. And if at any point in time it is uncomfortable, you just have to say so. We can reposition, we can take a break, we can do anything that we need to do to make it more comfortable for you. Pap smears are to pick up any early changes that can lead to cervical cancer in the long run. And especially in our population, what we have been seeing is that the rates of cervical cancer have been increasing. And not only has it been increasing, but it has been affecting a younger population. So all women who are sexually active should have their pap smears done. The timing for the pap smears are done according to specific age groups. So up to the age of 50, it's recommended that the pap smears are done every 3 years. Between 50 to 65, they should be done every 5 years. And after 65, then there's no longer a need to do a pap smear unless you have a problem that requires it specifically. With regard to pap smears as well, as I said, they should be done, definitely. I think that's it there for
When should
pap
they
smears.
start, though?
Right. The general consensus was to start at the age of 21. However, in Trinidad, we follow the British guidelines, and that would aim to start at the age of 25 or at the point of sexual activity. For people that have higher risk factors for developing cervical cancer, so for example, if they have high risk sexual activity, if they would have started having intercourse at an earlier age, if they would have had multiple sexual partners, any history of a sexually transmitted disease, or a partner who would have had a history of a sexually transmitted disease, particularly if women smoke. These are some of the highest risk factors for the development of cervical cancer, and they should be screened as soon as they become sexually active.
Okay. And suppose a lady did a pap smear and she got a call. You know, whenever we hear calls coming in from healthcare facilities, we get a little anxious.
Yes.
And she's told, well, she needs to come in because an abnormality has been seen. I think her next question always is it cancer?
Right.
So talk us through that a bit.
Yes, I would also be concerned. Is it cancer? So the development of cervical cancer goes through various stages before it reaches the stage of cervical cancer. It is always best to come in and speak with the clinician so that you can know exactly what the changes are. Not all changes mean that it's cancer. And very early stage changes are curable with minimally invasive procedures that can be done, even in the hospital setting and the clinic setting, right? So having an abnormal pap smear does not necessarily mean that you have cancer, but it does mean that you have to be sorted out, you have to be seen, you have to be assessed properly, and we need to decide how we are going to move forward, right? So just to reiterate, having an abnormal smear does not mean that you have cancer. It doesn't mean that you are going to die. It doesn't mean that we are going to take off the womb. It doesn't mean that you can never have children again. But it does mean that you have to be assessed properly, and we need to figure out how to move forward. Trinidad and Tobago offers free healthcare, including cancer care for all gynecological cancers. Right, and as I said, in the majority of times, it is minimally invasive procedures, and there's no reason to be afraid to attend.
Thanks for sharing that and for also saying, I think what stood out for me was that there are some changes that we can actually cure.
Yes, that's
So in that instance, you're telling me that there are some changes we can see, maybe abnormal, but I can be cured and therefore I don't have to get a cancer. So I think that should be reassuring to ladies out there, and that you would be running to book your next pap smear as soon as possible if you haven't had it done within the last 3 years.
3 years up until the age of 50 years.
Right. We actually do have a week of activities coming up in the month of March, starting from the 6th of March and going through till the 12th of March. We're going to be commemorating and celebrating International Women's Day with a week of activities in the Southwest Regional Health Authority and nationally as well. You will hear more information about this soon. And one of the things we're going to be offering would be pap smears. So you can listen out to hear when we're going to be in a facility near you so that you can come in and have your pap smear done. In the Southwest Region Health Authority, we will be at the Point Fortin Health Center on Monday the 6th. On the Tuesday, we're going to be at the Couva District Health Facility. Wednesday the 8th, we're at Marabella Health Center. Thursday the 9th, we're at the Indian Walk Health Center. And finally, on the Friday, we're going to be at the Siparia District Health Facility. And each of these days, we'll be there between the hours of 2 p.m. to 6 p.m. We listen to you. We recently did a survey, and one of the things ladies said is that sometimes the hours of services are not convenient for them. So for this week, we're offering this extended time past 4 p.m. to 6 p.m. so that you can come in and have your pap smears done. And then on the Saturday and Sunday, we'll be at the San Fernando Teaching Hospital. You enter from level 3. So look out, listen out. It will be on the Southwest Regional Health Authority's social media pages. So that was just a little plug there for pap smears. So we're back to our panel, and I wanted to ask our dietitian to share with us about the nutritional needs for that menopause group that Dr. Hussein would have mentioned.
Right. So as Dr. Hussein mentioned, Menopause is not the easiest of times for a woman. A lot of changes tend to occur, especially mentally, and this definitely impacts the woman's nutrient intake. So I'd be wearing two hats while I'm speaking today, that as the yoga teacher and that as a dietitian. So what I've found in my practice is that a lot of women at this age, as my tertiary colleague as well mentioned, that gender-based violence is quite prevalent, right? And sometimes the stress that comes along with it, or the living situation in conjunction with the hormonal changes, all of the menopausal symptoms, it can be a lot for that woman to handle. And as a result, she may stop eating on time. She will revamp her diet completely, where she may think, okay, well, I have to cut out all white flour now because I'm going to just gain a lot of weight and it's going to have me feeling depressed. And then there's a cycle of depression where she cuts it out, then she eats all the sweet and sugary snacks and drinks, and then the weight comes on anyway. So what I like to promote is to breathe, take a step back, try to calm all of those noisy thoughts. So there are a lot of breathing techniques that I like to recommend, one especially known as the 555 count. So what this helps to do is to kind of calm all of the thoughts down so that you could now take some time to decide what is priority. So it's basically where you inhale for a slow count of 5, you hold that breath for a count of 5, and a slow exhale for a count of 5. And I've found that teaching this simple pranayama or breathing technique to some of my patients really helps to reassess what is priority during this menopausal period. In terms of the nutrient intake, what I like to recommend is stay on track. Don't try to revamp your diet completely. Focus on obtaining the nutrients from all of the Caribbean 6 food groups right through the life cycle. That gold standard does not change. But we want to place a little more emphasis now on some of the micronutrients that would be needed in greater quantities due to the simple fact of the body's aging process. So we want to focus on controlling our sodium intake, ensuring that it's less than 2,300 milligrams per day. We want to focus on adequate amounts of fiber, at least 25 grams per day. And we also want to make sure that our percentage of calories coming in from saturated fats and added sugars amount to less than 10% per day. So how do we do this? Stick to having your fresh fruit that contains all the phytonutrients, all of the fiber, all of the micronutrients that you need in terms of the vitamin C, the vitamin A. These would work as excellent healthy snacks to satisfy the sweet tooth in between your meals. Focus including high fiber vegetables and whole grains in your carbohydrate options. So we want to aim for quarter of our plate being our low glycemic carbohydrates, or those that are packed with fibers like your ground provisions, your whole grain rice, your quinoa. We also want to focus on, if you like to make your bake and your bread at home, infuse the flour with things like rolled oats, flax seeds, chia seeds. Remember, these things don't have to be expensive. You use the budget-friendly grains. And at least half your plate should be vegetables. So we want to continue with eating a rainbow. So all of your green, your red, your orange, your yellow. And of course, quarter of your plate should comprise with your lean cuts of protein, your fish, or a balance of peas and beans. That way you can ensure that you're getting adequate amount of protein to upkeep the muscle tissue that you have. Now, it's important also, besides eating well and taking care of your mental health, to get physical. So try to cut down on long periods of sitting down and aim to be active. These would include anything from 15 minutes of physical activity in the morning to 15 minutes in the evening. And remember, at this age, doing housework is not exercise. So telling me that you're sweeping the yard and you're climbing up and down your stairs is not physical activity. That is something that you do every day. So push yourself out of your comfort zone. Get into that frame of mind. Remember, check in on yourself. Check in, am I eating right today? Am I stressing out on stressors that don't need to be stressed out on? And how can I get myself feeling better through good levels of mindful and physical activity levels? Just to add in, just a little tidbit in terms of nutrition as it relates to cancer. I know sometimes a lot of people like to read things on the internet and consult with Dr. Google, However, make sure that what you are reading is backed up with scientific evidence. It's evidence based. We have a lot of myths as it comes out to what to take to cure menopause. There is no cure for it. Some of these supplements, like the black cohosh, the St. John's wort, the red clover, even the evening primrose, it may not always be effective or safe, especially combined with some medications that you might be using. We have certain drug nutrient and drug herb interactions. So definitely consult with your doctor before putting yourself on any of these remedies. I know we grew up using bush medicine as well. Some of these things also interact with the medications that we are using. So just try to ensure that you continue to consume foods from your 6 Caribbean food groups as it relates to cervical cancer, any sort of gynecological cancers and nutrition. Unfortunately, there is no food that can cure cancer. There is no one food that can prevent it. But what you can do is ensure that you get adequate levels of the phytonutrients, which help with along the way of prevention. So fresh fruits, fresh vegetables, your whole grains, good levels of physical activity, and of course to keep yourself well hydrated would all help during this menopausal time.
Thank you. You mentioned something about the salt intake.
Right.
2,300, and I'll just say it like that because I think for some persons they might want a little more practical application.
Right. So 2,300 milligrams, that's the standard recommended allowance for sodium for any adult 40-day. For those of us that are hypertensive, or I would like to say stress out very easily, a bit salt sensitive, we would look at about 1,500 milligrams per day, and that's literally a quarter teaspoon. So this is a quarter teaspoon of salt that would be added throughout your meals for the entirety of the day. So it's difficult to measure all the foods that we consume in terms of how much salt is in there. You can't see the salt. So what I recommend in terms of ensuring that you practice a healthy salt intake, try to avoid processed foods as much as possible. So when seasoning your food, stick to your fresh green seasonings, your fresh and dried herbs and spices. Avoid the packet seasonings. Read your food label. So sodium contents that contain less than 140 milligrams per serving, that would be considered low salt or more on the healthier option. Also, as I mentioned before, avoid any processed foods, things like saltfish, smoked herring, ham, bacon, sausage, salami, corned beef, sausages. All of these processed yummy foods that we like to consume aren't so yummy for our bodies. They do contain high levels of sodium and a lot of preservatives in there. So once again, these things can increase the risk of cancer, different types of cancer, when consumed in large quantities over a long period of time. So to keep on the low sodium option, try a fresh fish boljol instead. We know we're going through the period of Lent, right? Yes, fish prices are going up because budget is always an issue. When we look at food, I have no money to buy vegetables. Well, try planting a kitchen garden, plant some fresh herbs in your backyard. And gardening is also a holistic way that can help with our mental health as well. It's very nurturing knowing that there's something that you can put into the ground that will grow and nourish you in return. And in terms of using the fish, the cheaper fish alternatives, try those. If you want to use the tin fish, read your food label, aim for the options that are in a solution of water instead of those that are in a solution of brine. So think on your plate, straight from the garden onto your plate.
Great, thanks. I think we could think, but that quarter teaspoon sounds so small.
It is very small, but that's the added salt that you'd be adding to your meal. But remember, foods naturally contain salt as well. So it's not a no-salt diet, it's just a low-salt diet. So by using like your flavorful herbs, salt makes your food saltier, it doesn't make it tastier. So adding things like bay leaf, pimento, ginger, ground coriander, I can go on and on with all of the herbs and spices. This is what will really open your palate and make the foods a lot more pleasurable to enjoy, not the salt.
Okay, so you're reassured. Even if you don't add that set of salt you're accustomed to adding and you use our green herbs and spices, then we can still get a flavorful pot.
Most definitely.
Great. Miss Seeley, I am watching you and I'm wondering, and I know sometimes, and it's just to bring out a certain point, the question may be asked, can domestic violence affect me?
Yes. Domestic violence can affect anybody, and in fact, it affects everybody. But sometimes we believe that when you are perhaps a doctor or perhaps a professional, that you would not be affected by domestic violence or by intimate partner violence. The thing is, what's in your culture and what's in your plate as well affects your life. So what's in our culture? In our culture, there are a lot of persons who believe that male are superior to female. And so whether you are how bright or how intelligent, or whether you are earning more or less, they see themselves as superior to you. Conflict starts at that point. Because one of the things that I like in our Constitution, that male and female are equal, and they have their rights. The other situation that in our culture that affects us is that persons believe that a man should correct a woman, his wife or whoever it is, his girlfriend, by physically punishing her, physically beating her. The idea of gender-based violence affecting only persons in a lower economic state, or persons affected by some other social situation, is really not a true statement, and it's not true. It's a myth, because gender-based violence affects across the board. The other situation that people believe is that once they are married, once a woman is married, that her husband is entitled to sex at any time and all the time, which is, really a myth. Because if we go back to the law, a woman has rights over her body. What gender-based violence does is to remove that individual's rights and violates their rights. Because a woman should be able to say no, and that is accepted. Or you find that there is sexual coercion in the relationship, and we have a lot of visiting relationships, we have a lot of common law relationships now without marriage and so forth. And these are the situations that really, sometimes when people don't understand their rights as an individual, because take for instance, and a good example is that a woman might have 5 children or 4 children, and she has an economic problem, economic situation, and she gets involved with a gentleman who provides some monies or provides some sustenance for her, and she, being in the situation that she is in, would accept whatever he has to offer. But whatever he has to offer is also domestic violence. It's also a slap, maybe an insult, Sometimes it goes as far as a kick down, and people get, all of that. Yeah, is the bite, is the struggle, is the humiliation, is the intimidation. All of that takes place within that domestic violence, gender-based violence situation. And the thing is, we have so much examples of how these things could play out, because just recently on Facebook we would have seen how that played out with a couple of people, all right? That you would have and trust that individual to be a good individual to you, a good friend, a good companion, a good whatever the situation is. And so you would have trust that person to be able to strip yourself and do whatever. And then that person would take something and put it out in the public. That is a violation. It is also not only a violation to that person's human right, but it is because that person need to feel free and comfortable that they can enjoy a relationship with somebody, and whatever they do in their relationship, it stays private. But when you have these situations happening, and then people get all, everybody looking and making comment and having these thoughts, and then you would have other women saying, well, it's good for she, that kind of thing. Who she thinks she is or whatever. All of these things contribute to everybody getting a taste of the medicine, or everybody getting a taste of domestic violence, because this situation happens not only among poor people or persons who are not very well off, but it happens to everybody. Everybody. Apart from that, what is important, as I heard my colleague talk about meals and making decisions on meal, is that people have choices. We have to remember that as a woman, you have a choice. You have a choice as to what you would accept from anybody. And there is nothing in this world that will keep you from making that choice. It's not, according to my mother, you might be hungry, but you're not starving, so you would not put yourself in a situation to be more humiliated after you would have opened yourself up to someone. The idea is that we all need to be aware that gender-based violence doesn't just, funny enough, I would want to say this. So young women, professional women, meeting their dream, their sweetheart, and their dream guy and so forth. And when they met him, it was good. The relationship was good. But some things that we don't do is to pay attention to red flags. We say red flags because, but I heard other persons on the internet calling it green flags as well. But the whole idea is that you will see certain behaviors that you are going to pay attention to. You're dating a young man, and ups come, we have to go out. But he is running late, and you are waiting for an hour, and he comes. And you say, but we had this plan to go before at a particular time, and you are now here. Don't worry about that. That's a small thing. You will get vexed for that. That's small thing, you understand? That's how they, term it. But that small thing goes much further when you get into the relationship. That's a red flag. When people don't respect you. Because that is not just saying he had something and he was tied up, or she had something she was tied up in. It reflects on your respect for that other individual. And so that we have to pay attention to these things. You are dating a young man and they say to you, well, I don't mix with my family. That's something you need to pay attention to, because that's a serious red flag. And while everybody is independent and adult persons don't need their families, family connection says something about your character. Attitudes, when people, and I mean serious attitudes, when you come to, you meet someone and you hear them speak to another person in your presence, you know that the person is going to suddenly, after a while, it's not going to happen, but after a while, that same individual is going to speak to you in that manner, and even worse. So the thing is, we have to pay attention to those red flags. Because if we don't pay attention to them, we end up in this situation. And this situation it has no boundaries. There is no boundaries to gender-based violence. And so, not because I have my car, I have my house, and I'm driving, I have a good job, doesn't mean to say that gender base would not fine you. If you don't pay attention, it will certainly fine you, because you can get into a situation where the gentleman comes to you and he is happy to have such a wonderful woman, and he takes you out and he puts you up, and he shows you off because you have now become the trophy girl, because you have worth. However, pay attention. That trophy girl tomorrow might just be the financial supporter of a person who don't really care about working. He looking for somebody to mind him. Now, this is it might be a joke, but the majority, if you talk to people, you will hear. The other day I heard somebody said, "Me, I looking for a woman to mind me." This is a big man talking. And I'm saying that is the attitude of some people.
Yeah.
So imagine you and your husband is now, happily married, and he says to you, and this is how the financial situation comes about. Happily married, and he says to you, "Listen, babes, we have to plan this thing out well. So you are going to pay the mortgage, all right? The house is on both of our names, and I'm going to save my money. Yeah? And whatever we need, we will get it from the savings, and you pay the mortgage." But he buys a car, and the car is not on your name. The car is his car. Then he comes and he buys other things that is not on your name. It's on his name. And he said, "Babes, what you worried about? What is mine is yours as well." And you fall for that because you are in love. Yeah? And you are happy to have a man at your side. The thing is, we must choose. The food that we eat, we must make sure that it is nutritious for our body, as well as we must make sure that the persons we are choosing are good for us, male and female, because we are persons who have rights.
Yes.
We have rights, and our rights should not be violated, male or female. And we have to pay attention to who we are having in our space. And if you find yourself in a situation where a gentleman is not, or a female person is not, standing up or up to your standard, then you have the right to choose to excuse yourself from that space. And you have the right to report the matter if it is becoming beyond your control. The only persons that have control of themselves is the individual. We don't have control over anybody else. So if I am happy with the gentleman and I take $10,000, all my savings that I have, and I give it to him to hold or to do some business with it, and he tells me that he is going to give it back to me, and I trust that, then I have to face the responsibilities of what happens next, because I don't have control over him. I have control over what I do. So whatever I do, that is my responsibility. And sometimes we have to pay attention to these things. Who is to blame in the domestic violence situation? Who is to blame?
You have us listening very attentively, and ladies, I hope you are listening too. Pay attention to red flags and make sure that you choose wisely when you are involved in situations and relationships. I just wanted for us to address some of the questions and comments that we're receiving on YouTube. So the first one is for our dietitian. The question is, what is the latest time in the night that I should drink water so I don't get up many times during the night? So pass water.
Right. So that's actually a question that I get a lot of times, and I like to tell my clients or my patients, you need to ensure that you're getting an adequate level of hydration to begin with. So there's a simple formula. I like numbers. I like to be precise. So if you can find out your weight in kilograms and multiply that weight by 0.0333, that determines the exact amount of water that you should be taking in for the day. So it's not the standard 8 glasses, which is approximately 2 liters. Now, if it is you find that you consume a lot of your water towards the evening time, of course, you're going to get up multiple times to go to the bathroom. This is going to affect your sleep. It's going to reduce your sleeping habits, and it's going to make for a lot of problems to occur later on. So maybe shift that water intake for during the earlier half of the day, so that winding down to the evening time, you slow down a bit so that it will equal fewer trips to the bathroom. However, be mindful that if you are on certain medication or diuretics, these things can cause you to go to the washroom regardless of the time or hour of the day. So I hope this answer helps.
And I would just add to that, that if you're noticing that you are having frequent visits to the bathroom during the night, a couple of things you should also consider. Diabetes is something that can cause persons to pass excess water. So if you haven't had your check done recently for diabetes, that's something you should also do. Also, in men who may be experiencing some type of prostate problem, they should also have themselves checked. So don't just put it down to that you're drinking water at night and therefore that causes you to get up. Because usually when you're sleeping, you usually don't wake up at least for a few hours, well, even if you need to go to the bathroom. So just to bear those things in mind. The next question is yours as well. And the person asked, if one is using the canned fish that is in water, can olive oil be added?
Right, so you have two options with the canned fish in terms of reading the food label. I have found that the nutrient profile between the fish in the water and the fish in the oil is almost the same. However, the salt content is what will differ. So if it is you want to add, remember the fish in the tins are naturally high in omega-3 fatty acids already, so there's no need to add the olive oil or any oil to it for that matter. If it is you choose to add olive oil is very volatile at a high temperature, so I'd recommend you add it just before the fish is finished cooking, as if it starts to smoke, the chemical structure of olive oil changes and it can actually become a saturated fat.
And someone just wants to confirm the calculation for the water, yeah.
Right,
Kilograms
so it's
by
your weight in kilograms by 0.0333.
0.0333. Thank you very much.
You're welcome.
And then there is another comment. A lack of communication in a relationship is also a form of abuse.
And that's quite true. What happens is, this is a situation that sometimes is perpetuated by the fact that persons get involved. And again, respect for each other. Once that situation becomes the relationship and you would have accepted the individual as not speaking, because some people are like that. They say they're very quiet or they introvert, and so that person is not speaking. So when they get into a relationship and there is no speaking, there is no talk, it then becomes a problem, because you need the communication. You need the communication so that you would be able to help build that relationship in a positive way. And communication, positive communication, not the yelling and the screaming and the cussing and those sort of things, but being able to sit with each other and have conversation that would be able to invite persons to be able to share their innermost thoughts with each other.
Thank you. I think that is a point well noted. And I talk about it a lot in my job as well, that how important communication, even for the basic day-to-day things that we have to accomplish. So communication, ladies, make sure you're talking to each other. We are winding down our program this evening, so I just want to give each of our panel members a minute just to give final words and to summarize what they would have shared with us today. We'll start with Dr. Hussein.
Right. So, I'm glad that we're winding down. Again, thank you all very much for the opportunity to be able to speak on behalf of, Swrha, in terms of obstetrics and gynecology and women's health. So in summary, it's great to be a woman. It's great to be a female, regardless of what anybody says. I look forward to the day when we can be treated 100% as a male. However, until that day comes, being a woman is a wonderful thing. There are many services available for us to take care of ourselves. And as Ms. Seeley says, we have to make the choice to do it. The services are available, the services are free. There are guidance available medically, mentally, emotionally, through all stages of a woman's life. It's just to reach out and take it. Women are accustomed being the caretakers of everybody else, but we need to take care of ourselves as well, because if we don't take care of ourselves, then we can't take care of anybody else. Adolescence and teenage years, being a young woman, being a mother, being a woman that goes through menopause, it all comes with challenges, but we are ready and we are able to assist and help. Just make yourself available.
Thanks, Kiri.
Okay, so just to summarize, nutrition throughout the life cycle for a woman is multifaceted, but one of the key things to remember is to always remember to check in on you. So nourish your body well, hydrate your body well, and remember to just be active and check in on your mental health. So remember to eat on time. Try not to skip any of your meals. Remember, we have 6 Caribbean food groups out there, and there's always a budget-friendly option that you can include on your plate. Regardless of what situation you may find yourself in, your health is your first priority. You cannot take care of others if you cannot take care of yourself. So nourish your body well. And remember, whatever mental challenges you have, sometimes some of these mental stressors are out of your control, and you may just have to accept the fact that you have to just let it go and focus on you. And of course, that movement works wonders throughout pregnancy, adolescence, and even throughout menopause.
And Miss Seeley.
Thank you again for being here and for allowing me to share this panel today. Share on this panel. I would like to say to our young women and to our old women, to our young boys and our old men, we all were given an opportunity to live. We all were given the opportunity to make choices. We have free will. And our situation in this earth is based on some of the things that we believe. And if we believe that we are worthy of a good life, then we have to choose that. Sometimes we need others to help us, and it is important for you to seek help. Isolation is one of, not a good situation, because it can lead you into a place of becoming or affected by gender-based violence. So my advice to persons is that you get friends, you start to talk, you find information that will help you, because you too are important. You are important just like anybody else, as my colleague would have said. And it is important for you to remember that your life matters. Your life matters. We would not like to have any more, we wouldn't like it. The deaths of 2022, we would want to avoid that situation. So as much as possible, to the ladies who are being affected by gender-based violence, there is help. There is help available, and we are asking you today to make a report. If not you, then your friend. Make a report. If not your friend, then a neighbor. Be a good neighbor. And so we all need to try to be good, not only for ourselves, but for others. And stress too brings a lot of problems, not so? Mm-hmm. Stress. And so long as we are in that place where we are experiencing a lot of stress, then we have a lot of disease and sickness and so forth. And ill health and all of that. So I am saying today, make a choice for good life. Make a choice for a good life, for yourself as well as for others. Make your choices today. It is important that we all make choices.
Thanks once again to our panel. I think they really educated us today. Just to give you that information I gave earlier again, for the week of the 6th to the 12th of March, we are going to be at select health centers across the Southwest Regional Health Authority, where you can access things like your pap smears, get advice. I saw someone mention that Miss Celia and her team needs to be across in all the communities. And just to let you know that on those same days in the morning session, her team will be attending these health centers. So from the 6th to the 12th, it's in this order: Point Fortin Health Center, Couva District Health Facility, the Marabella Health Center, Indian Walk Health Center, Siparia District Health Facility, so that's Monday to Friday. And then from on Saturday and Sunday, we'll be at the San Fernando Teaching Hospital on level 3 from 10 to 3 p.m. daily. During the week, the sessions they're split in two, so we'll have 2 p.m. to 6 p.m. So if persons want to access their pap smears, get some basic screening done, even do their same-day HIV testing, they can do so then. And in the morning period from 9 to 11 a.m., we will have a mini seminar similar to what some of the information that was shared here today would be done in each of those health centers and Ms. Celia and her team will be one of those speakers on those days. So we're looking forward to that. I want to just say thanks to the management of WAC Radio Studio for hosting us this evening and for allowing us to use this space. Thanks to our speakers, thanks to the management of the Southwest Regional Health Authority. Do join us again. This program is called Checking In on You. Look out for us once a month. It's usually the last Tuesday of every month. Check our social media pages at the Southwest Regional Health Authority. We're on Facebook, Instagram, and TikTok, apparently. I'm not on TikTok yet. Maybe I'll get there. But we do look forward to having you join us. So look out, listen out for us as we come to check in on you. Do have a good evening.